Gesh. Dr. Gesh is a senior technical advisor in ICAP at Columbia University. He's a public health specialist with a public health program. He has been supporting LabCoP from the time LabCoP started, and he'll be making a presentation on M&E fundamentals, basically walking us through the various concepts of M&E. So thank you so very much, and Gesh, welcome. Thank you.
Thank you, Michael, for that introduction. I would like to appreciate the LabCoP team for your effort in initiating this important subcommittee of practice. I also would like to thank you, the participants, for joining the learning webinar. So this is the presentation of today. We'll have some brief introduction on MND, MND Plan and Framework. We'll see some examples and essentials of MND, including indicators and data sources, and the essentials of MND, data collection, as well as reporting of routine monitoring data. So by the end of this session, we expect every participant to understand the components of MND system and measure the existing status of parallel MND implementation process and set goals to improve MND implementation process. It's just the end of the session. You are expected to understand and do those things, and we
compréhension de tout cela. Donc veuillez rester.
Existing parallel MND system in your setting, and revise and design framework to use the subcommittee of practice for developing MND plan. Not today, but based on the lesson, based on this session and the upcoming session, we want you to revise your plan or develop the VL M&E system in your setting. So we'll have an assignment that you're expected to complete at the end of the session, and you will have a clear plan that is going to be a competency-based education then. Before I proceed to my presentation, I would like to highlight that most of the information in these slides are for you to read after the end of the session and use them as a guide for further understanding with the aim of improving viral load scale-up. Of course, the presentation is a bit generic on MND since it is an introduction, but will highlight that we need to consider in every step of MND and the background for upcoming consecutive learning webinar series. So I may not need to go to the details of each slide content, but would like you to use it as an introduction to read more. Having said that, we will start from the introduction, and we can define what MND is. MND is a process by which data are collected and analyzed in order to provide information to policymakers and others for use in a program planning, as well as project management and monitoring and evaluation system. It accurately tracks and reports rate of viral load coverage and suppression, and helps to design and monitor intervention for improvement. That's the whole objective of having MND. So a strong monitoring and evaluation plan also requires clarity on data flow, data elements, and indicators for monitoring. In our case, for viral load, using the viral load data, it is essential for patient level and program level decision making and improvement. So that's the whole objective of MND. That's why we want to discuss more on this and build your capacity. Let's define some of the concepts or monitoring and evaluation. What is monitoring and what is evaluation? We need to answer the question before we go to the details. So Monitoring is a collection of routine data to track changes in a program performance over time. I would like to repeat that one. Monitoring program performance over time. So this is a continuous activity. It tracks effectiveness of the process, which is important for achieving the goal, whereas achievement of goal will be measured by evaluation, not monitoring. So the monitoring is a continuous process to measure the performance over time. Sometimes monitoring is referred to as process evaluation because it focuses on implementation process. I would like you to be clear on this. Monitoring is a continuous and routine data collection as well as analysis of change. It is not a one-time activity. It addresses the question like, how well has the viral load program been implemented? How much does viral load implementation vary from site to site, from district to district? Did the program benefit the intended people? At what cost? All these things can be monitored using monitoring. Whereas evaluation, it measures how well the program activity have met expected goal or expected objective. So the extent to which the change in outcome can be measured. And usually data collection at the beginning of the program and at the end of the program is required. In your situation, probably you made the evaluation at the end of the year after you just implemented different intervention or initiated the program. So that is evaluation. Probably you may also have a control or a comparison group to measure and see the difference. So that is the difference between monitoring and evaluation. This is just to show you the different components of a strong national M&E system. M&E system. This is not only for viral load M&E, but also for any program, for any M&E for any program M&E, these components are required. And we may not go to every component, but you can always check these components to have a strong M&E system. Whatever M&E system we have, we need to answer these 4 key questions from the foundation upon which the M&E system is built. 1, what does the project want to change and how? What are the specific objectives to achieve this change? And what are the indicators? And how will they measure this? And how will the data be collected and analyzed? If we address or if we respond to this question, we'll have a very good or a strong M&E system. We have a poll just to check your understanding on the difference between monitoring and evaluation. Michael, can you display the poll, the first poll?
A minute as I pull it out.
Okay.
I don't know how to pull it out. Anafi, please activate the poll if you don't mind. Thank you.
Yeah, I can see the poll. So the question is, monitoring and evaluation are choice A, the same. B, different. Monitoring is the routine collection of information to track progress. Evaluation is used to determine the relevance and fulfillment of objectives, developmental efficiency, effectiveness, impact, and sustainability. Option C, different. Monitoring systems are determined during the planning phase, while evaluation is determined at the end of the project or program. The last option is they are the same. So we would like you to respond for this. We'll have like 20-25 seconds. Looks like everybody already responded. You've got the answer. That means you understood that oh, more respondents are coming. Yeah, thank you very much. I think all of you understood the difference between monitoring and evaluation, and the answer is B. They are different. Monitoring is a continuous activity to see the progress of the process, whereas evaluation can be done the beginning as well as the end of the program. You can see the result. Everybody have got the answer. All right, let's proceed then. So the second component of our presentation is just to see MND plan and frameworks. And in the beginning, we already saw the list of components for a strong MND system in general. These are just to discuss about some of the components of M&E plan. I would like everybody to have this WHO document for viral load M&E. I'm sure Michael, whenever he's sharing this slide, he can just download and send it to you together, and so that all of us will have the document. So M&E plan is the fundamental document that details a program objective and intervention developed to achieve these objectives, and describe the procedure that will be implemented to determine whether or not the objectives are met. So there are different components under M&E plan. We'll see that one M&E plan should be created during the design phase of the program, and revised whenever a program is modified or new information is required. As you can see from the picture, M&E plan begins during the program development, and it is completed around the start of the implementation. We can start doing it immediately after that. But if there is no plan at all in your setting, it is time for you to develop a new plan. Otherwise, you are expected to revise and update that one based on the lesson we'll get from this learning session. So these are the main components, and it has introduction. It may have a detailed program description and framework, a detailed description of the indicators, data collection plan, a plan for monitoring, evaluation, utilization, and finally, a mechanism for updating the plan. These are the critical components of M&E plan. When we say introduction, this is just to describe the purpose of the program and the activities required, the motivation of stakeholders and all those things. And you may even include information about the specific M&E activities and a developmental history that provide information about the motivation of internal as well as external stakeholders. That's the introduction, is obvious. In terms of program description and framework, that is the program goal and objectives. And the third one, a detailed description of the plan indicators. Indicators will be discussed more in detail later, but one of the most critical steps in designing M&E system is selecting and defining appropriate indicators. So the M&E plan should include description of the indicators. When you say description, the numerator, denominator, additional information, those should be there. Data collection plan, obviously, there should be a clear diagram or a clear structure to describe the data collection system, the processing, analysis, and reporting mechanism. So when you say data collection plan, it addresses all these things, and there should be also a plan for monitoring, evaluation, and utilization of the information gained. Finally, a mechanism for updating the plan. Let's see at least the two the program description and the framework, as well as the plan for monitoring and evaluation, because those are the others are very clear. So I'll be focusing only on the second and the fifth one. So the program description, it addresses problem statement so that it is possible to define the program goal and objective. And the goal is just a broad statement about the desired long-term outcome of the program. As an example, improvement in the outcome of people with HIV would be just the goal. And an objective could be to improve viral load testing coverage by year, the specific year. So those are the program description, and for each goal and objective, we need to follow the SMART criteria. It should be specific, measurable, appropriate, realistic, and timely. I'm not going to take more time on that because most of you know that, and you can also refer. And the second component, that is a plan for monitoring and evaluation. A plan for monitoring, it describes how this monitoring will be conducted and what are the indicators that will be used to measure results. So when we say a plan for monitoring, it should address these things, and a plan for evaluation, it provides methodological approach. What are the methods to be used to identify whether change in outcome can be attributed to the program? So a clear plan need to be there. And one of the major challenge in resource limited country is probably the data would be there, but are we using that data? Are we distributing or sharing the data to all the stakeholders? That's one of the critical things, and we need to have a plan for utilization of the information we collected. So, so that's the next one, plan for utilization of the information we collected. Now, let's come to the common types of frameworks. There may be additional type of framework, but the common ones are conceptual framework, result framework, as well as logic model. We can see one by one. This is a conceptual framework. Sometimes it is called research framework. Conceptual frameworks are typically shown as a diagram illustrating causal links between between the key component of a program and the outcome of the interest. The outcome of the interest, that means the health status. As you can see, all these are the different factors which is linked to the outcome of the interest. So this is a very general example of conceptual framework in the health sector, and it includes a number of factors that affect the desired outcome, including those not under the control of the program, like individual factor. As you can see, individual factor or characteristic is also included, which may not be under the control of the program. So the arrow indicates the relationship between factors, which is in case include individual, systematic, and program variables. So this provides a perspective for understanding program objectives within a complete context of relevant factors in the operating environment. So that's why they call this one sometimes a research framework. It's just to give you an idea what conceptual framework is, and you may not be confused with a log frame, which we'll be using for our purpose. So this is also a result framework, the diagram that direct causal relationship between incremental results of key activities. You can see the different list of activities, and so that at the end you address key component, and finally there is a result. So the list of the key activities lead to a result. This one that leads to the result. We can take this one as an example to increase viral load utilization and finally improving a patient outcome. There should be improved quality viral load testing services and increased access to early testing and prompt treatment. In order to have this one, this list of activities are required. So at the end of the day, we'll have increased viral load utilization. So they call this framework a result framework because everything leads to the result. The logic model, I'm sure all of you know this, you've seen in one way or the other program. A logic model, sometimes called MND framework. It provides a streamlined, linear interpretation of projects' planned use of resources, as well as the desired end or the desired outcome, and provide clarity on the project assumption about linear relationship between key factors. It has inputs, output, outcome, and impact or final results. When we say input, as you can see here, we're referring to the different resources required for implementing the program. And there are list of activities required to address the objective and what are the immediate results, that's output, and set of results at next level is the outcome, and finally the impact. In our case, improving patient outcome. So based on this, we'd like you to develop your own logic model or a framework in your setting. So that's going to be one of your assignments at the end of the session. And when you come back for the second presentation, by that time, everybody submitted their logic model based on the setting and based on your setting. So this is just a simple logic model diagram, as you can see. It can be used just to complete a sentence. We plan to do X, which will give Y result. So we plan to establish MND system for improving patient outcome. So you will use this logic model format and it will have a problem statement or goal, this one, or objective. And you need to list all the resources you need to implement the viral load program, and what are the strategies or list of activities required to achieve the goal, and what are the immediate outputs from each activity or group of activity. You will have an input, and then there may be a short-term outcome or long-term outcome. It's based on your reference. You can just list all the outcomes together, or you can categorize this way. And obviously the final impact is improving patient outcome. And there may be an assumption. When we say assumption, it includes like regular monitoring or continuous monitoring, or involving or engaging stakeholders throughout the process, starting from the planning to the evaluation at the end. So those could be the assumption. Obviously, this is clear. And at the same time, whenever you develop this one based on this format, you will learn more. Michael, can you post the second poll?
Okay, just give me a second. There you go. Can you see it?
Yes, I can see the poll. Thank you. So the question is, why do we use MND framework? Because we already discussed about MND framework, and based on this, what do you think the importance of having this one? One, for communication and plan as a communication and planning tool, or it will be used as a map for program goals, and it also links between resources and activities, guide selection of indicators, either A and B or all. Which one is the answer? We have 10 more seconds. All right, based on our discussion, as you saw, whenever we have this MND framework, it captures most of the information. Let me share oh, sorry. Let me share the results. Most of you, 71% of the participants responded as all. Yes, the answer is all, because it will be helpful for communicating and for planning, and it will be used as also a map for program goals, because you define the goal and you have also the list of activities, you have the different list of indicators and outcomes. So it is just a map, and it also links between resources as well as activities, even to the level of the impact. And it will also guide for selecting indicators. So it is very important to have all these things if we develop the framework. Let's proceed to the third topic, that is essentials of M&E, that address indicators as well as data sources. I will be a bit quick on this. So indicators, it measure inputs, resources, and list of activities. We already discussed about process from input to the output. We need the list of activities, and indicators are required to measure all of them, and it helps to address the question how the program is implemented, and how the viral load program can be scaled, and its utilization can also be improved based on the data. So output and outcome indicators, it address the question what we want from those activities. So indicators can be either quantitative or qualitative. Usually qualitative indicators are descriptive observation, and it needs a lot of resources, whereas quantitative indicators are numeric, and in terms of viral load, you may use registers and all those things to collect information. So this is just the description about the different indicators, input indicator, process indicator, output as well as outcome indicators. So the input and the indicators for a process address the question how the program is implemented, and whereas the output and the outcome, it addresses the question how, what do we want, what is the result we need, and finally why we need all these things. It's just to improve the outcome of the patient. So that's the outcome. So the indicators that address the result will address the why question. So this is a list of indicators along the HIV response in the health system, and these are global indicators for monitoring and evaluation of health sector response to HIV, starting from the required resources, output, outcome indicators along the HIV care cascade. So our focus for viral load scale-up and utilization is on the effective ART as well as viral load suppression. So when we zoom in to this area, we can see the list of indicators. This is the viral load cascade, and indicators can be developed based on this cascade, starting from identifying or number of eligible people for viral load testing, and the number of people requested for testing and specimen collection and all those things. And at the end, result is used to guide treatment. So these indicators will help to monitor the program, and indicators requiring data that realistically can be collected need to be identified, and we would like you to use such structure for identifying and defining list of indicators. Even in the self-assessment tool, as you know, most of the information, most of the questions are based on this viral load cascade. So for you to define the indicators, you can use this as well. When you zoom in again to the result utilization, you may go to the number of people with unsuppressed viral load and those who completed the enhanced adherence counseling starting from the first to the third. And among those, number of people who received repeat viral load, so you may just proceed that way to define and list the indicators. This is just to highlight the importance of selecting appropriate indicators. It is just a principle for any program in selecting indicator. So you need to select indicators that are realistically measuring the program, and select at least one or two indicators for each activity. It may not be really realistic to viral load, but it is just to tell you that you can use this principle for selecting indicators. And these are also the different characteristics of a good indicator. They have to be plausible, attributable, and cost-effective, targeted, and verifiable. Especially if it is a quantitative indicator, definitely it is verifiable. We need to check all those things. So you may use this criteria for selecting indicators. Data sources, it could be a routine data source or non-routine data source. When we say routine data source, it provides data that are collected on a continuous basis, such as information that you collect from clinic, whereas non-routine data source provide data that are collected on a periodic basis, usually annually or less frequently. So based on this definition, when we say routine data source, we may have list of resources for viral load, and for non-routine data source, we may have examples for viral load. So I want you to text some examples for both of them as routine data source as well as non-routine data source. Maybe you can start from routine data source. What could be the list of routine data source for viral load? You can just write on the chat box what are the routine data source for viral load, whereas what are the non-routine data source for viral load. Definitely, LMI's monthly viral load summary report, National Viral Load Register, Information System, EMR. Thank you very much. Those are great examples, and that's also true. Sorry. How about the non-routine data source? That you may not collect, let's say, every month. There may be different indicators or information you want to, even high viral load cascade, those are used for survey. Yes, survey on the program, probably that is non-routine. Yes, it's a very good example. Thank you very much for that response. So you understood what I'm talking about then. These are just a list of examples. You already mentioned it, viral load test requisition form. This could be one of the source, or you also mentioned the HIS2 and electronic data. You can use all those things for routine data collection for viral load, whereas, for instance, laboratory information management system or program management, and those things you may not collect data regularly every month. Rather, you may just do that one on a periodic basis. It could be annually, something like that. This is just an example. This is the final topic I would like to highlight. Data collection, in data collection, we already mentioned in the beginning that plan need to be there. So the MND plan should address the data collection plan that summarize information about the data source, how the data will also be collected, and how it can be stored and all those things. So the plan need to address the timing and frequency of the collection. For instance, we are collecting aggregate viral load data monthly. Are we collecting quarterly? We need to define all those things. And probably at national level, you may compile at the end of the year. It depends on the settings, but in the plan, we need to include or define those things. Or who's responsible to manage all these things, to compile the data, the information needed for indicators, like the required information. It includes numerator, a denominator, and additional information to the indicators. We need to define all those things. So why we are emphasizing on this, when you develop M&E framework, M&E system, you need to define all these things, and so that everybody will be on the same board. So please, as much as possible, try to address all these things in your plan, and so that it will be clear. Regarding data flow, we need to develop a structure for data flow, not only from facilities to district and national level, but also the data flow in the facility. This table, it provides a way to document the flow of data through the system from the source to the data use. So you can use this table to describe and structure your data collection and analysis flow as well. So as you can see, you can clearly define the source and the collection, who's collecting that, and how you can store, and how you also do the analysis and reporting, and how you can also use the data. When we say use, we're saying for decision making, as well as for sharing the result to stakeholders for improvement. This is one of the major problems in various facilities and countries. That means quality of data, and we need to include in the MND plan how to address the quality. Data must be high quality if they are to be relied upon for making good decision on health policy, health program, and the allocation of scarce resources. So data give a picture what is happening, but if you get a bad data, definitely it would mislead us, and it's very dangerous. So we need to really ensure the quality of the data, and the goal of MND system is to produce data that are used to document progress towards a goal or objective and to improve health programs. So data quality assessment need to be there. For instance, data quality review tool is developed to evaluate data quality across the program areas, not particularly to a specific program. Data quality audit that is a formal auditing of data quality for priority indicators. It's focusing on the list of indicators, and whereas data quality assurance, routine data quality assurance, that is for monitoring the data over time to show trends in the reporting system capacity to produce high quality data. In general, the message here is we need to have a data quality. In order to do that, in order to have a quality data, we need to have a regular assessment and assurance so that it would be essential for decision making. Finally, I would like to highlight that data by itself doesn't make any change unless we use it. So obviously data or information is required for decision making, and assurance of the program is really important, and data are used to inform policies and plans, raise additional resources, strengthen program, and all those things. This is obvious. So when we say data use refers to the decision-making process, and the decision maker uses the data if he or she is explicitly aware of the decision to be made. And it also consider at least two possible courses of action, analysis and decision, and consider relevant data in making the decision. So it's very important to analyze the data and share with the stakeholders and use that data for decision or improvement of the program. So what can we do to address these challenges and improve evidence-informed decision-making? We can commit to utilizing data that result from M&E system in the decision-making process, and this data can inform the design of new program and intervention planning, as well as managing the program, and in the end it will contribute to a better health outcome. Under evaluation, I'm not taking time on this. Obviously, process evaluation, it determines whether a program activity, the program activities have been implemented as intended. And we already talked about the process indicators and evaluation focusing on those indicators to measure effectiveness of a program or viral load in our case. So the process evaluation, it focuses on the indicators which addresses the activities or the process starting from the implementation of the program to the end. So outcome evaluation, it measures program effects in the target population by assessing the progress in the outcome that the program is to address. For instance, viral load. The outcome is improved viral load suppression, and evaluating that outcome is outcome evaluation. Whereas impact evaluation, it measures the difference in the outcome of interest between having or not having the program, or having the intervention or not having the intervention. For instance, in terms of improving patient outcome, we need to measure whether our program really helps the people living with HIV by monitoring the viral load. So those are the different key evaluation methods. In summary, an effective viral load M&E system should have a clear map of how data flow from one source to the another and how data are captured at each step. So we need to consider all these components when we develop M&E plan. And we need to also target a list of indicators, for instance, for viral load. The MND system need to address at least these two major core indicators: coverage and outcome of routine viral load testing. We track number of people currently receiving ART, receiving viral load test, and follow-up of people without suppressed viral load. There are a list of indicators, as you can see here. So generally, this is just to say that you can use such indicators for monitoring process, quality, and patient outcome along the viral load cascade. Finally, based on the discussion we have, I would like you to respond to the last poll. Michael, thank you very much. As you can see, what are the major challenges of viral load M&E? We already addressed some of the components of M&E. And based on your understanding, what is the major challenge? There is no defined list of indicators. Lack of clear viral load scale-up logic frame, or poor knowledge or understanding on the basic concept of M&E. No M&E framework. Which one is the major challenge in your setting? There is no right and wrong answer, but we want to get just information. Which one is the major challenge in your setting? Okay, I see that in most of the respondents, all of them are a challenge. If that is the case, honestly, we are expected to develop an M&D plan or establish a system based on this subcommunity of practice. Definitely it will help to build your understanding as well as capacity to develop the plan. This is competency-based education. Is not just a theory, because we'll give you an assignment and you deliver that one. We'll monitor, give you feedback, and finally you can revise and finalize the plan. So I can see that certain people say there is no defined list of indicators, others lack of clear viral load scale up. Anyway, all of them are a challenge as I can see. I hope you can see the result, but most of them say all of them are challenges in your setting. Thank you. So finally, I would like to say that you are expected to develop M&E logic model for viral load, considering your setting. And we would like you also to identify viral load M&E stakeholders and about their contribution and their involvement, so that we will address the next session. Now we have a few minutes for question and answer. Michael, maybe you can.
Yeah, so thank you, Gash, and thank you for that very important presentation. I have picked two questions from the chat box. The first question touched on how do you measure quality? That's the first question. And then Faith from Kenya asked, in absence of a strategic plan, would you still develop an M&E plan? Hi, Gash.
I was on mute. I'm so sorry. Those questions are great. Definitely, it is. I already addressed some of them, but just to mention that for any program, when we implement M&E or a program, the M&E system needs to include quality assurance or assessing the quality of the data. So you may use different checklists to see if the indicators really reflect the actual activities at the facility level, as well as even at the national level. So we need to regularly monitor, or we need to have a quality audit for indicators, as well as routine data quality assurance using a checklist, using a tool, whether the data are collected on time, collected properly with the defined indicators, like the numerator and denominator need to be defined very well, and based on that, if staffs are collecting that one properly, we need to check all those things. So I just want to highlight that quality assurance is very important, and we can use different checklists to monitor the quality. A strategic objective, regarding strategic objective, it is very important for M&E. As I mentioned in the log frame, we define the goal, we define the objective of the program. So without having a strategy, it is not possible to list the activities. So we need to have a strategy. We need to have a detailed description on our approach and method, and so that we can list the process. So the strategies define the process. So we need to have a strategic approach for the program. Obviously, if you don't have that, let's say in your country you don't have a strategic plan. If you don't have that, you can use any regional or international strategies, and so that you can able to list the key activities, and so that you can link it with the output, the outcome, and the like. I hope I addressed your question.
Thank you, Gage. And Moyo Lowlands is wondering or asking, can indicators be scaled up over time? For example, starting with 4 indicators, and then let alone increase them to 8.
I think you're asking if it is a phase-based approach for defining indicators. Am I correct?
Yeah, so can you start with, for example, 2 indicators when you're starting the project, then by the time you're ending the project, you have 80 indicators. That's what he is asking.
Okay, in terms of defining indicators, I think we need to have a detailed information on the required indicators. But in terms of data collection and implementation, you may identify certain indicators. You may prioritize that one, but in your plan, there should be exhaustive list of indicators, and the indicators need to be also be defined clearly. So there is, it doesn't take that much resource in order to define the list of indicators, the expected indicators. So I recommend having all the expected indicators defined, and then in terms of data collection and implementation, you may prioritize some of them, but as much as possible, for instance, for viral load monitoring, these indicators are critical, and we need to include them. Thanks.
Thank you, Gage. And Miriam is wondering the timeline for submission of the assignment. I think that basically will communicate. I recognize that we have 2 minutes before the end of the hour, and I also want to highlight that the presentation today that Dr. Gage has made was detailed because we appreciate the team, and we thought it would be extremely important to make sure that we bring everybody up to speed. Within the forum, we have some people who have done M&E for an extended period of time, but we have people who have also not interacted with M&E as much. That's why we're having this presentation today. So I'll hand it over to Gesh to make any closing remark that he might be having. Gesh, please go ahead.
Maybe you can, because we want to check their knowledge based on the presentation. Can you just post the poll and so that everybody would respond quickly? It doesn't take that much time. It is just a simple question.
Unfortunately, Gesh, I don't think that poll is up. I don't think we set it up. We didn't set this poll up, and I'm sorry about
okay.
that. Yes.
Okay. In that case, what we can do, Michael, we can send a link for them to complete this knowledge checks, and so that we see if there is any gap, and so that we can address in the consecutive session. Otherwise, thank you very much for attending, and as much as possible, try to use this slide. And as I recommended in the beginning, you can use also the WHO M&E document, which addresses most of the things, and even our self-assessment tool, which we always send you. It has list of indicators, and it will help you to define and describe all the required indicators. And in terms of the assignment, it is just to develop a log frame based on our discussion, starting from the input to the outcome. And you can have different regional resources to define your own log frame based on your setting. And before the next session, we would like you to send the draft framework, as well as a list of stakeholders that will help the program to Michael, and so that we can review it. Michael, back to you.
Thank you so much, Gesh, and thank you so much for that very wonderful presentation. It's on the top of the hour. We have actually 1 minute past the time. I just want to highlight that a few announcements to make. The first one is during our discussion last 2 or so weeks ago, we went through the various stakeholders and the people who are supposed to be in the M&E Sub-Committee of Practice so that the country can have comprehensive discussions. Please look again at your team and see the extent to which is representative of the various stakeholders that we have highlighted during the previous presentation, and then you can invite them to the M&E Sub-Committee of Practice. As Gesh was making his presentation, he highlighted the issues of he referenced M&E framework by WHO, and that will be the content of our presentation on 4th of March. We'll be having a presentation from WHO, basically highlighting the M&E consideration for viral load, for developing an M&E framework for viral load. And then, of course, he talked about indicators. We have a session that is scheduled for the month of April, again, also indicators, and he highlighted on the issues of data quality, and we have a session on data quality in the month of May. So I just want to thank each and every one of you. That I have seen a number of questions asking whether the presentation will be shared. Yes, the presentation and the session recording will be shared. Thank you. Good morning, good afternoon, good evening, everyone, and kwaheri. Bye. Thank you.